Well, small business owners warning that national health care will force them to cut jobs. That is already happening in Massachusetts. That state's health plan slaps fines on companies not providing health insurance. Top Democrats want to do the very same thing across America under the view of cost efficiency. The next guest says, look out. Judy Briggs owns a Massachusetts franchise, of 1-800-GOT-JUNK. Some things just can't make themselves up. So, Judy, what does this mean right now for you at this stage for your business?
For me, I've already made some cuts. However, moving forward, if this bill passes, I'm going to have to make some significant cuts in my operations, potentially, losing a couple of people, which will impact the growth of my business.
Would you have a kind of a Faustian choice here, ultimately, Judy, if I read in between the lines here, that you can either continue to offer benefits on your own to your workers or opt out and pay the penalty. Where would you lean?
I would actually have to take a look at the numbers. If I'm forced to pay for 72% of my workforce, it may be a little cheaper for me to go the penalty route, but the bill is not clearly defined as to other things that could potentially arise as a result of just paying the penalty and not the health care benefits themselves.
All right, so even if you were to pay that penalty, thinking that in the long run it's cheaper than continuing costly insurance the way you've got it now, you're afraid that you might get zoomed on the other end, right? That there'd be another penalty
Correct.
on top of that. Have you talked to anyone about this, or even talked to your local representative that, look, this is an ongoing concern, small and medium businesses are afraid they're really going to get hit?
I haven't talked to any of the local representatives. However, in the small business community and even the middle and large business community, we see this as a potential for disaster moving forward. It could crush businesses and force them to close, thus increasing the unemployment rate, which is already increasing as we speak.
You would be among those, I think, and if I'm wrong, please, Judy, don't hesitate to correct me. Many do. But you would be among those who would be affected with these higher rates. So on the one end, you would be paying the higher rates, on the other end, potentially exorbitant health care costs. So that's a double whammy for you there, right?
Yeah, I mean, I'm fortunate in the respect that my employee average age is about 20 years old, and they carry individual policies. If I had an older population and that carried family policies, I could go from $12,000 a year, what I presently spend, to about $96,000 a year, and that would really significantly impact my business.
But Judy, the president says folks like you are rich.
Somebody's getting rich, because it's not the business people.
It's not Judy Briggs. All right, Judy, thank you very much.
Thank you so much.
All right, well, it is